Good morning again. We are delighted to have you here. My name is Perry Hoffman, and I'm president of the National Education Alliance for Borderline Personality Disorder. I will tell you more about our organization later today, but I do want to welcome all of you. We're delighted to have you here. This is the second conference we've done at UCLA. Our organization has, I think it hit its 50th mark of conferences, and this was the first conference that we took outside of the New York area, and since then have been continuing to grow with conferences and other initiatives. My thanks to all of the people at UCLA and people in New York who've made this conference possible. A lot of things go behind the scenes. What you'll be hearing today is treatment for adolescents and young adults, and we're delighted to say that this finally exists. I'm sure many of you know that there's been a real groundswell to make sure that people under 18 are getting the diagnosis, because only with getting the diagnosis can they get accurate treatment. That being said, our next step is to get awareness out there so people recognize that some of these symptoms are a disorder and need treatment. So we hope that you all will join us in that next effort as we embark on that. It's now my pleasure to turn the day over to Dr. Robin Kissel, who will be the moderator and is the co-host of this event. Thank you.
Good morning. Thank you all for coming. We're just delighted to have you here, and the NEA.BPD and UCLA and I are delighted to be offering this conference. I'm Robin Kissel, and I'm director of the Borderline Personality Disorder Initiative here at UCLA. We are a program that's dedicated to the treatment and study of BPD, and we've been in existence for about 5 years, and we hope to be growing by leaps and bounds, which I think we are, but we can tell you more about our efforts later in the day as well. But now I'd like to begin to get this conference going. This was the brainchild of Blaise Aguirre and Alec Miller. They did this a similar form of this conference about a year ago on the East Coast, and when they called me and said, "Hey, what do you think about doing it on the West Coast?" I thought, wow, what a terrific idea, as it gives us a chance to bring the work that's been done back east together with the work that's being done in the middle of the country and also here on the West Coast. So you are going to hear, as Perry said, about the research in terms of understanding the emergence of BPD earlier, and also the burgeoning treatments that are going to be available for BPD, the treatment of BPD in adolescents. As most of you, I think, know, BPD has been a diagnosis reserved for adults and those over 18, even though clinicians were well aware that it was emerging much earlier. But only really in the last 5 years have we begun to focus treatment and the efforts of research towards this younger population. And as Perry said, it's incredibly important, because we know that if we can intervene at an earlier point in time, we are going to be affecting the course of these patients' lives as well as the quality of the lives of their families. So this is really important work. So I welcome our speakers and thank you for participating in this today with us. And let me attend to a little bit of housekeeping. You've all, I think, signed in at the back of the room, but what's most imperative is you sign and fill out your evaluation forms at the end of the day, because without returning those, you will not get your CE or CME credits, so make sure you hand those in. Let's see what else. Restrooms are out in the lobby. We will be breaking for lunch at around noontime. Lunch is on your own, and I direct you downstairs to the massive food courts of the Student Union. If you want to take the time, or you can walk fast, you may want to go outside to some of the little cafes and things that are on campus, but do mind your time boundaries that way. What else? There are going to be a little stack of 3x5 cards in the middle or the front of your tables. We're going to use those for questions, and we may take questions at the end of each speaker. Each speaker will have an hour allotted to them, and if there's a little bit of time at the end, we'll address questions then. If not, we'll collect all the questions and address them at the panel discussion before noontime. And you can fill out your questions on the little card and then pass them on to attendants who will be roaming the aisles and collecting them for you. Okay. And with that, I just want to thank all the people who have helped us put this conference on. First, Trish Woodward, who unfortunately cannot be with us today because her flight got canceled at the very last minute. And we miss her and wish that she could be here. And then I'd like to thank James Rosser and Dan Cupper, who work with me, and Ed Spencer and Julie Hall and PJ Thomas and Brenda Gonzalez. Thank you, thank you, thank you for all you've done in the last few days to help me pull this off. And of course, Perry and others in the NEA.BPD. And with that, I think we should get started. Okay, so let me introduce to you Dr. Efren Bleiberg. Efren is a professor and medical director of the Professionals in Crisis program at the Menninger Clinic in Houston, Texas. He's also director of the Child and Adolescent Psychiatry and Alicia Townsend Friedman Chair in Psychiatry and Developmental Psychopathology at Baylor College of Medicine, again in Houston. Dr. Bleiberg is written prolifically and is a well-respected and renowned clinician, and I think you will find it's a great pleasure to hear him give a talk. He will be speaking on MBT, which is one of the evidence-based treatments for BPD, and you're going to hear also a lot about DBT later today. And MBT and DBT are really at the forefront of the treatments that we have to offer that we know to be effective.